In 2023, tuberculosis killed 1.25 million people globally. India alone carries 26% of that burden, more cases than any other country on Earth. While national treatment programs have expanded, the official case detection rate sits at 73%. 1 in 4 TB patients remains invisible to the health system. That is approximately 910,000 people every year who go undiagnosed and uncounted. They continue to transmit the disease, often dying of a condition that is entirely curable. To find them, state-level program officers rely on quarterly notification reports, but these are raw counts without context. Decisions about where to send mobile screening teams are made using static spreadsheets and local experience. Finding these patients requires a system that can predict where the disease hides by mapping the social conditions that drive it. This is the logic behind TB Sentinel AI. TB Sentinel AI is an open-source pipeline built on real-world evidence. The system uses zero synthetic data, instead merging 3 distinct official data streams. The foundation consists of official state-level notification records, sourced directly from Indian parliamentary sessions between 2020 and 2024. The second stream is the National Family Health Survey. This provides the social determinants of risk: child stunting, anemia prevalence, and access to clean sanitation. This map shows priority based purely on clinical notification rates. Using this data alone, resources go to Chandigarh. But when layering weighted social drivers, severe child malnutrition, and anemia, priorities shift. Chandigarh dims while intense risk zones emerge across Uttar Pradesh and Bihar. A comparative bar chart reveals the true burden. While Chandigarh has a high per capita rate, Uttar Pradesh combines clinical burden with extreme social vulnerability, leaving an estimated 94,000 cases undetected. Relying solely on clinical reports can lead screening units to the wrong districts. Mapping social vulnerability provides a more accurate map of where the disease is actually spreading. The core of the system is the Gemma 4 reasoning module, which translates these risk scores into actionable plans. Standard language models often struggle with public health data, hallucinating non-existent medical statistics or providing generic advice that health officials cannot use in the field. To prevent this, TB Sentinel AI uses a tool-augmented pipeline. A hard gate stops the AI until it triggers Get State Metrics. This pulls exact numbers for stunting, anemia, and missed cases from the risk engine, injecting them into the context window. Only then does the AI generate its brief. The result is a numerically accurate summary that recommends specific interventions, like nutritional supplementation in high stunting districts. This same data can be formatted for 3 different audiences: for a district collector, for a frontline clinician, or a research analyst, ensuring the information is useful at every level of the program. This architecture turns a chatbot into a grounded decision engine, where every recommendation is traceable to official government data. The system also includes a scenario planner. This allows managers to simulate the impact of increasing active case finding in a specific district, calculating the potential yield before deploying teams. Transparency is built into the interface. Every output includes explicit confidence labels and lists any missing indicators, so officials know exactly what the data does not cover. Because of strict data sharing regulations, the reasoning module runs entirely locally. Sovereign patient data and district burden estimates never leave government-hosted servers. The gap between estimated incidents and detected cases is a challenge shared by high-burden nations like Indonesia and Pakistan. These regions face a similar data infrastructure problem. Clinical and social data remain in separate silos. The architecture of this pipeline, fusing clinical records with social drivers, is designed to be portable. It offers a blueprint for any health program looking to close the gap and find the cases that haven't been counted.